There we go. Okay, let's start with this. So this is, I think, believe this was, yeah. So this was like the denim thing that happened a couple days back, where she called a bunch of VTubers not horse, I guess goonmate, goon, and Nyara, the probably biggest grift is to defend the whore instead of defending your the people who are in your, what do you call it, who use the same medium you do. I don't like saying community because VTubing is more or less a medium, and then communities form around each creator. So it's like this person responding to Nyara, Denim's responded to Nyara saying, "Yeah, these people who say they're Oshis, yep." And then, of course, the T-Man is still out here clinging to false allegations and spreading more lies. Trans kids exist, and supporting them isn't. Child abuse, shoving them into torture camps to fix them is. For some reason, it's become very, like, common. People who, like, know nothing about psychology or, like, biology. Like, me, I'm not, like, an expert, but I did enjoy, like, my psychology class. Was a really good teacher, and he did talk about John Money, which will be important to what I'm about to get into. And you see I have tabs open on it. Trans kids do not exist. Disabled, like retarded parents do. Parents like forcing an agenda onto their children. You see this. So trans people make, I don't know, less than 1% of the population. So like they're really rare. But when you look at celebrities, for some reason every like celebrity has a trans kid. And then there's like one celebrity that has like three like trans kids. So they're really not, the statistics don't really add up. Um, Kids are like not, like they're not like, there's a reason why we say like no alcohol until you're 21, or you can't drink or like smoke cigarettes or get a tattoo until you're 18 without like the consent of your parents. But even with like regarding like trans, I don't think parents permission should be a factor in whether a kid gets transitioned or not. People, this should be something for adults. Like when I was a kid, okay, maybe, okay, I'll talk more about it after. There's another video that pertains to this. But a lot of kids are a lot, well, they kind of, I think, especially during like puberty, when they're trying to like find their place. They are like not really sure what they want in life. They are like very emotional, very what do you call it? Impulsive as well. So like they like a lot of times teens make decisions like they instantly regret. Like maybe they had argued with their parents and then they regret it. They're like very impulsive, or maybe they like drink alcohol and drive, or like do drugs and stuff. Well, they're all like very impulsive actions, and a lot of can be affected by others around them. And normalizing the idea of trans children when most, I believe, there's like, okay, the main issue, okay, we'll get into it. Okay, hold on. We'll wait. I have tabs lined up. We'll get into it more. So, your response to that, how John Money proved trans people right. We'll get into who John Money was and see why this is a retarded take. Oh, you quite literally made a video supporting one of the most horrific human beings to ever experiment on poor innocent children. Your words mean nothing, Nyara VT, and everyone who supports you deserves to have, so who supports you to have horrible things happen to you. Alright, this is not making sense. Well, I just don't think that should happen. I don't think horrible things should happen to people like that. It's a little dangerous. A little dangerous of a thought. I would not wish horrible things happen to people. We'll leave it at that. But I hope that they learn. I guess have a moment of learning. I don't think Nyara's going to ever learn. Nyara has kind of doubled, tripled, like quadrupled down on things that should be like obviously be like seen as like gross or like bad. Also, they like Hassan, so it's like, eh. Well, we'll see. Who was John Money? Okay, John William Money was a New Zealand American psychologist, sexologist, and professor at John Hopkins University, known for his research on human sexual behavior and gender. I feel like this guy is like Freud on like if he was like Freud on like on steroids. You don't know who Freud is. He's also kind of freaky psychologist guy. Maybe I'll do something on Freud later. Money researched unusual sexual interest, including pedophilia, and pioneered the use of drug treatment to extinguish the libido of sex offenders. He advanced the use of more accurate terminology in sex research, coining the term gender role and sexual orientation. Despite widespread popular belief, Money did not coin the term gender identity. Money was a proponent of genital surgeries for children with intersex conditions. Again, children. Arguing that gender was malleable the first 2 years of life and living. Gender was malleable in the first 2 years of life is fucking disgusting. And that live outside the male-female binary was harmful, or living, and that living outside the male-female binary was harmful. What does that even mean? Uh, Practice proved controversial when many intersex people later rejected the gender assigned to them. So that's completely different. Intersex people, you don't know, are people who have both male and female genitalia, and they make an extremely small amount of the population, basically negligible. But they are not this. People with intersex are not the same people, are not the same as people with dysmorphia, or not even with dysmorphia. Just like they're not like in general, they're not going to be the same as children, like regular children that don't have like who are not intersex. It's like obvious because it has different, completely like weird, like messed up hormones. Not being rude, try not to be rude, but that is just what it is, or what can happen. So, Money also applied protocol to David Raymer, who lost his penis in a botched circumcision, and advised his parents to raise him as a girl. Raymer struggled with um, and exhibited masculine behavior. Oh, wait, sorry. Raymer struggled and exhibited masculine behavior and reverted to living as a male when he became aware of the treatment and later died by suicide after his brother's suicide. Publicly surrounding the case resulted in significant damage to Money's reputation. Now, we'll get into Raymer. David Raymer. David Raymer, born Bruce Peter Raymer, basically changed his name 3 times, was a Canadian boy raised as a girl following medical advice and intervention after his penis was severely injured during a botched circumcision. Well, I should probably get this tab back. This would be important. Um, the psychologist John Money oversaw the case and incorrectly reported the reassignment as successful and as evidence that gender identity is primarily learned. Not true. Gender, for some reason, I don't know. Gender is not a social construct. I'm not sure if it's stated in anything. I think it was somewhere. Gender is not a social construct. Men and women are different in many different ways. Men have more higher muscle density than women. Women have more flexibility than men. Women are typically more suggestible than men. What else? Like, we are very different, like, psychologically and physically. Like, we have different organs as well. We have, well, obviously, talking about sex organs, not like heart, lungs, and stuff. Like, we have the same organs regarding that, but we have completely different things that like are distinct. That distinct male and female. Gender is not a social construct. It is just. It is a fact. Uh, the academic sexologist Milton Diamond later reported that Raymer's realization that he was not a girl occurred between the ages 9 and 11, and that he was living as a male by the age of 15. Well known in medical circles for years anonymously as the John Joanne case. Reimer later went public with his story to help discourage similar medical practices, which obviously didn't work. I have another thing to look at. He killed himself at the age of 38, 2 days after separating from his wife. Okay, so it actually gets worse from here. David Raymer was born in Winnipeg, Manitoba, on the 22nd on the 22nd August 1965, the elder of identical twin boys. He was originally named Bruce, and his identical twin was named Brian. Their parents were Janet and Ron Raymer, a couple of Mennonite descent who had married December 1964. At the age of 6 months after concern was raised, okay, I think I just flashed something that was inappropriate. Hopefully that, okay. I'll make sure not to hover on that link again. About how both of them urinate, concerns after both of them, how both of them urinated. The boys were diagnosed with phimosis. They were referred for circumcision at the age of 7 months. General practitioner Jean-Marie Hout performed the operation using an unconventional method of electrocauterization, but the procedure burned David's penis beyond surgical repair. And I'm assuming they don't do that anymore. That sounds horrible. That sounds like the absolute worst way to get a circumcision. I heard like circumcisions in practice are actually not that good, or actually have like very minimal benefits. The doctor did not operate on Brian, whose phimosis was later cleared without surgical intervention, so he was completely fine. That's crazy. Yeah, so he didn't get the surgery. The parents, concerned with their son's prospects for future happiness and sexual function without a penis, took him to John Hopkins Hospital in Baltimore in early 1967 to see John Money, a psychologist who was developing a reputation as a pioneer in the field of sexual development and gender identity. And the people still use his terms till this day, even though he was basically a mistake of a human being. Based on his work with intersex patients, though he tried to apply a small portion of the population to everyone. Well, let's just do a quick search. What percent of the U.S. We'll do this U.S. population is, I guess he's Canadian, but I'm gonna do U.S. because I live in the U.S. 1.7%. Intersex people are more sexier, such as sexual anatomy, hormonal patterns, or that do not fit male. That 1.7% of the population are born with intersex traits. So, what happens if you apply 1.7 of the population to every single person? It doesn't sound very smart now, does it? This also is also gonna be important. How much of the... Oh, I started talking this already. I guess trans is not good as dysmorphic. How did population as gender dysphoria. I spelled formia wrong. Go formia wrong. Even less. 0.005 through 0.014 of individuals signed male at birth. 0.002 to 0.003% of individuals signed a female at birth. And they're higher estimates here, but they're still very low. So even lower, actually, than 1%. Like a lot lower than 1%. Oh, how do celebrities have three trans children? I don't know. That's a still be a mystery to me, I guess. Not really. I know why. Is okay. Yeah. Research on intersex patients and basically try to apply it to the entire population is not very smart. There's like someone who, I don't know how he became a researcher. There's no way. If you like any like respect for like any like research, then you should know that it's not good to like take a tiny sample size and apply it to the entire population. Money was a prominent proponent of the theory of gender neutrality, that gender identity developed primarily as a result of social learning from early childhood, and that it could be changed with appropriate behavioral interventions. And you'll see, well, you see up here, obviously that did not work, and you'll see. So I looked into this article a little bit, and I kind of stopped when it was getting gross. So, but I will try. I think it should be fine to finish on stream. Um. Shall it be changed? Appropriate interventions. The Ramers had seen Money being interviewed in February 1967 on the Canadian news program This Hour Has 7 Days, during which he discussed his theories about gender. At the time, his surgical construction of the vagina was more advanced than the construction of the penis. I read that wrong. And Money believed that Raymer would be the happiest adulthood living as a woman with functioning genitalia. It is not functioning. It's actually quite different. It's kind of basically mutilation. I wouldn't. Like, I don't mind doing this. Like, it doesn't like matter if like adults decide to do this to their body, because that is a decision that they made, and they have more like the logic. As long as they like actually think about it and they don't do it based off of like what others are doing, they do it because they genuinely think that it's like best for their body. Then yeah, I have no issue with trans people, dysphoric people getting surgery, like either top or bottom surgery if they feel like that's the most comfortable like body for them. But doing it to children that still have their entire life ahead of them is it just does not work out. And I have another tab for that. We'll get into it. Money was and the Hopkins family team persuaded the baby's parent that sex reassignment surgery would be Raymer's best interest. At the age of 22 months, David underwent a bilateral orchiectomy in which his testes were surgically removed and rudimentary vulva was constructed by using plastic surgery. David was reassigned to be raised as female and given the birth name Brenda, similar to his name Bruce. Psychological reports of reassignment surgery were provided by John Money, who continued to see Raymer annually for consultations and to assess the outcome. This assignment was considered an especially important test case of social learning, concept of gender identity, for two reasons. First, Raymer's identical twin brother, Brian, made an ideal control because both the brothers shared the same genes. Family environment and the entourage environment. So this is why this is important. So in Minnesota, there was something called the Minnesota Twins experiment, where they basically tried to test nature versus nurture. I'm not 100% how sure they did it. They probably maybe looked for people. Some like people would probably divorce some people with same nature to see how their life went. But I think studies kind of say that it's 50-50 between nature and nurture. Alright. Second, this was reputed to be the first reassignment and constructed performed on a male infant who had no abnormalities of prenatal or early postnatal sexual differentiation. Forced sexual rehearsal. This is kind of where it gets gross. Okay. Money reported on Raymer's progress as the John and Joanne case, describing apparently successful female gender development. Even after David informed his father at age 14 he had always felt like he was a boy, bringing that experiment to an end. According to John Calapinto, who published a biography of Raymer in 2001, the sessions with Money included that child money called childhood sexual rehearsal play. Wait, sessions. Oh, sorry, I can't read. The sessions with Money included what Money called childhood sexual rehearsal plays. Childhood sexual rehearsal plays. Sorry, hold on. Childhood sexual rehearsal plays. How John Money proved trans people right. Alright. I'm not sure if they are the same thing as I am. Money theorized that reproductive behavior formed the foundation of gender uh, and that play at thrusting movements and copulation was a key aspect of gender development in all primates. Starting at the age of 6, according to Brian, the twins were forced to act out sexual acts, with David playing the female role. Money made David get on all fours, and Brian was forced to come up behind him and place his crotch against his buttocks. Money also forced David in another sexual position to have his legs spread with Brian on top. On at least one occasion, Money took a photograph of the two children doing these activities. How John Money proved trans people right. Hello everyone, this is a segment from my Twitch stream. In this video, I talk about John Money's cruel experiments and what it actually proves your gender ideology. Cruel experiments proved that your idea of dysmorphia and trans ideology is correct. When either child resisted these activities, Money would get angry. Both David and Brian recall that Money was mild-mannered around the parents but ill-tempered when alone with them. When they resisted inspecting each other's genitals, Money got very aggressive. David said he told me to take my clothes off, and I just did not do it. I just stood there and screamed, and he screamed now louder than that. I thought he was going to give me a whooping, so I took my clothes off and they're shaken. Money's rationale for these various treatments was his belief that childhood sexual rehearsal play was important for a healthy adult gender identity. So this is basically Freud's idea of how like basically every aspect of your adult life is sexual. Like someone who is anal um did not was like either potty trained too long or taken off too early. People with oral fixations were not breastfed, like either not breastfed or taken off too early or taken off too late. Like anal fixation, oral fixation. I think there was other ones as well. It's basically has, I don't know. Maybe he's like going off of Freud's research. I don't know who was first. Both David and Brian were traumatized, with Brian speaking about it only with the greatest emotional turmoil, and David unwilling to speak about the details publicly. although his wife, Jane Fontaine, stated that David had privately told her the same story. Puberty and adolescence. Estrogen was given to David during adolescence, therefore inducing breast development. When I wrote, this child's behavior is so clearly that of an active little girl and so different from the boyish ways of her older twin brother. The twin attended Glenwood School in Winnipeg, and the age of 14, David attended R.B. Russell Vocation High School. He eventually ceased attending the school and was tutored privately. By the age of 13, Reimer was experiencing suicidal depression and told his parents he would take his own life if they made him see money again. Finally, the 14th on 14 March 1980, Reimer's parents told the truth about the sex reassignment. Following advice from Reimer, endocrinologist and psychiatrist at the age of 14, having been informed of his past by his father, Reimer decided to assume the male gender identity, calling himself David. He underwent treatment to reverse the reassignment, including testosterone injections, double mastectomy, and full philoplasty operations. Okay, adult. Raymer worked in a slaughterhouse and then worked odd jobs. On the 22nd of September 1990, he married Jane Fontaine and would adopt three children. His hobbies include camping, fishing, antiques, and collecting old coins. His case came to international attention in 1997 when he told his story to Milton Diamond, an academic sexologist who persuaded Raymer to allow him to report the outcome in order to dissuade physicians from treating other infants similarly. Soon after, Raymer went public with his story, and John Calapinto published the widely disseminated and influential account in Rolling Stone magazine in December 1997. The article won the National Magazine Awards for reporting. This was later expanded into the New York Times bestselling biography As Nature Made Him, The Boy Who Was Raised as a Girl, 2000, in which Calapinto described how, contrary to money's reports, when living as Brenda Reimer did not identify as a girl, he was ostracized and bullied by peers who dubbed him Cave Woman, and neither filler dresses nor female hormones made him feel female. Death. In 2004, Reimer was grieving for the death of his twin brother Brian from an intentional overdose of psychiatric medication 2 years earlier, and visited his grave every day. He had recently lost his job, had lost $65,000 in investments, and had separated from his wife. On the morning of May 4th, 2004, Reimer killed himself with a shotgun in his hometown of Winnipeg. He was 38 years old, and he and Brian buried in the same cemetery in Winnipeg. Bonnie never commented publicly about Calapinto's book on Reimer's suicide, although colleagues said he was mortified by the case. So, this literally feel like this disproves a lot of like trans activists like thoughts on like gender identity and like trans ideology. And it proves a lot of something that I have thought to be true. Oh, sorry, I didn't even have my other things open. Oh, hello, gamer James. I'm not sure if I'm sorry, I didn't have my chat open, so I'm not sure if you're still here or not. I haven't paid attention. So, because so you look at the stat I brought up earlier. So the main aspect of like trans people is dysphoria, and you can see that this is like the basically stat of people who are actually like who just have dysmorphia. And my psychology teacher said they're trying to remove gender dysmorphia from the DSM 500, which is basically the Bible for like psychology. It has like ways to diagnose every single like mental illness in it basically. And it's like constantly getting updated. I think dysphoria is a mental illness. Not like it's not like a bad thing, of course, because many people have mental illnesses, and I don't consider those people to be different from regular people. I mean, like with it's like the same as people with like anxiety or depression. It's like the same thing. It is a little bit more extreme on when it comes, I guess. Well, I guess there are different cases of it, just like all mental illnesses. Some people don't need to get surgery. Some people are fine with just changing their clothes, or some of them are just fine with either only top surgery, only bottom surgery. Some of them need both of them. And the thing is, um, there is like a very loud, because like trans people don't make a very big percent of the population. There is a very loud majority. Oh, sorry, I didn't know there were other people in the chat room. My bad. I see you guys now. Emma Plath, I think oral stage. I think the oral stage is a fine stage. I don't know what you mean by that. Engage your own set. And then yeah, I need to fix my chat. My bad. They make a very small amount of the population, and then people who like benefit the most from like keeping gender norms alive. Even though when I was young, we were trying to get rid of these gender norms, like transgender ideology wasn't super common as I was growing up, but now that I'm an adult, it's become super common. And I think we would try to get rid of that, but now the people who benefit most from having like the ideas of like gender norms, despite John Money not liking the idea of gender norms, people benefit from most are like trans activists. Basically, I I know it's a kind of a little conspiracy, a little bit strange. I think the reason why they want to force this on children is because they want more people to get indoctrinated into their ideology. They want to create more people like them, people who are just as dangerous as them. And they want these things to become normalized so they can get away with more things. So you can see I think trans people in general, I don't know. I don't know a lot of trans people, but I feel like a lot of them would be just normal individuals. I think there's not a lot of them though. Uh, I think a lot of them would agree that trans women should not be able to participate in female sports. But then you have the loud majority of people who aren't truly like actual like dysphoric people, or or they're have extreme ideology, take the reins of basically the trans movement. Because I feel like a lot it was people didn't really care that much if someone was trans. Like back when I was growing up, I don't think people really cared. And now that there are like more extremist groups forming around, um, I want to say trans people, but I guess trans ideologies, people who are basically taking over the movement, have they want to make life like easier for them. They want less laws to be applied to them, and like another aspect, it's like trans people going into the women's bathroom. So I guess most of the time this wouldn't be an issue, but I feel like we've been seeing increasing like cases of people who aren't necessarily dysphoric or people who aren't actually trans, going into the women's bathroom and using the excuse that they're trans to like go into the bathroom and to like be creeps. And I don't think those are trans people. I would be very clear. I think trans people are normal people. Like they're the same as everyone else. They just have a mental illness, and people have different ways to deal with mental illnesses. Maybe it would be therapy. Maybe therapy doesn't work, and they need to wear different clothes to affirm themselves better. Those are like normal people. Those are people who dysphoria. They don't cause any issues for people around them. They just want to be seen as they just want to be seen as like individuals, basically. While I think trans activists and like autogynephiliacs have basically tried to make it so everyone who is trans is synonymous with them, would have the same ideology as them, and because of that, a lot of like people's like thoughts on like trans people have like deteriorated over time. Because I feel like a lot of people didn't care back then, but now a lot of people are seeing like a lot of extremism by like trans people. And let's like move on to the next thing after this. Here. So this is someone who detransitioned. So these are the people who are silenced from the who are always get like silenced by like the trans movement. No offense. This is the best way as I can refer to it. I would be more clear about this. I don't think it's trans people. I think it's people who've taken over the movement. I care more about what an individual does, and I don't like to group people up. I am the least racist person in the world. That's a joke, by the way. I care more about what an individual does. I don't like applying um, the ideologies of a single individual to everyone, kind of like what Nyara does. So we'll get into that as well. So let's like this. Watch this detransitioner. This is why I'm okay with leftists attacking me when I work to get bans on transitioning kids. No one should end up like this. This is barbaric and inexcusable. We must federally ban all forms of transitioning kids. And make the distinction right here. Transitioning kids.
An entire life that should have been mine. That was my birthright. I don't know how this happened to me. And I'm just so angry. I'm so sad. Like, I just don't know how this happened. Like a virus or something. It just like infected me and it happened so quickly. And it was like I was right there, like agreeing to every single thing. And I don't know how that happened. Then now I can sit here and like look back and be like, why did I do that? It doesn't make any sense. None of it makes any sense. If I just would have waited. If I just would have waited. If I just would have waited and let myself heal. I can't have kids. I'll never lose my virginity. Like, I feel like I'm left to just like accept the scraps of the life that I could have.
I'm not sure what age they transitioned at. They'll probably say maybe in the video. So I don't think I like cover this. So the reason why I think this completely proves like how the John's money own experiments basically kind of like crushed the modern day, like it kind of crushes like the modern day like idea of what trans ideology is. So if you look at it, hold on, let's look at another stat quickly. Suicide rates of trans people. Okay, so here, 2023 analysis of global studies found the following lifetime rates among the transgender population. So suicidal thoughts 50%, suicidal attempts 29%. So I think my theory behind this is that many of the people who transition aren't necessarily like experiencing just like dysphoria. There is other things going on, and it's like clear if these surgeries um truly worked, then why is the suicide thoughts and suicide attempts rate so high? Like, if these things truly worked, then why is it so high? There are other factors that we are missing, and This case, it could be just um, 30%. Sorry, I read a different one. I lost my train of thought. I got distracted. Uh, I think even though it's already like a small amount of people who get, so these are like transgender people. These are not people who are who have like dysphoria. We already checked. So it's like a super small amount of people with dysmorphia. I'm gonna check how much. If we look it up, how much trans people are trans. I'm not sure if we get the same result or not. Many people are trans in the U.S. percent. They'll probably give me a percent anyways. Is this one? 2.8 million. I want a percent. I am very concerned that I see 13 through 17 in here. 1%. So that is age 13 and older. That is already much higher. So there's something wrong. Here, let's go back to this. Gender dysmorphia. Basically feel like you're born in the wrong body. It's basically this the main aspect. Gender dysmorphia. It is a mental illness. It is diagnosable. It is in the DSM-5. It is a mental illness, and it's diagnosable. And you see right here, 0.005% to 0.014% for male individuals at birth, and then it's even lower for female individuals at birth, 0.002, 0.0033. So, how can we look at that, and also see, alright, how is it possible that there's 1% of the population, 13 and older, identify as transgender? And for some reason, it's the highest at 13. Oh no, it's the highest at youth. What the heck? At youth. Wait, what? Total? Oh, this is the total. What? There's the difference. I guess the AI is gonna be a little bit iffy. How is this possible? It does not add up. So that means a lot of trans people aren't actually dysphoric. Oh, hi Finn. I am discussing kind of a pretty controversial topic. What up, Finn? This is a more controversial stream. I just want to get thoughts on something, and this is also kind of a weird like research stream. I looked up a lot of stuff. All right, sounds good. I need to focus. I will hop into your stream after I'm done, and I'll be observed. All right, thank you, Finn. It's okay. Going back into what I was talking about. Sorry about that. A little distraction. We'll continue. So, my theory is the reason why the suicide rate is so high among like trans people is because a lot of them are not actually trans. They don't have dysphoria. They have a different issue. Maybe they have anxiety over their body. Maybe like puberty. They or they're uncomfortable with their penis maybe, or they're uncomfortable with their breasts, and then they just feel uncomfortable with their body, which isn't dysphoria. It's like just being like more uncomfortable, like your changes in your body, and then a lot of times maybe they get forced into certain ideologies, and then they when they realize that they've already like messed up their body, um then they think they're the only solution is or the only thing they can do is like they tried like the top surgery, they tried bottom surgery, they tried like changing their voice, They tried growing out their hair, they tried keeping their hair short, all that kind of stuff, and then nothing actually helps because they're not truly dysphoric. They've basically been lied to, and because they think they've tried all they could do, and then they end up killing themselves or they end up attempting it anyways. So that is like basically this is basically proof. Like literally looking at these numbers is like kind of proof, kind of like literally breaks down like what like gender ideology is. Like not even like the people who are trying to spread like people who try to like spread their own thoughts on it are not even correct on it. Because you can look at the data, you can literally see it as I look at what I'm looking at. The numbers do not line up. Sorry. So that's kind of like something that I have theorized about for a long time, but I never actually literally looked at the data. But now that I have looked at the data, I've kind of been like, I feel like I've been proven right about what I thought. I feel like a lot of individuals were getting indoctrinated into certain ideology or getting forced into trans ideology despite not being dysphoric, and they maybe had depression or anxiety instead, and then they ended up taking their life because they were misdiagnosed. So I think there's an. We'll continue this one.
Bad. I had this full life that I'm now having to mourn while also living in the present moment with the life that like feels just like the scraps of what could have been. I don't know how to be happy in that. I don't know how to be okay with that. I hate when people are like everything happens for a reason. Like no, this didn't happen for a reason.
So I'm not sure what gender they are, but I think they talked about it already. I already did watch this video already. So you can imagine like basically at this point it's become like forcing to transition your kids. Kind of become it's become like trendy. I'm gonna look at the next thing. You will see how that has become a thing. It's basically forcing trans kids to make like making trans kids like farm content. But you couldn't like imagine like making a. This is like a very dangerous like decision. Um, like if you make this decision, like many aspects of your life change. You can no longer like a lot of stuff is irreversible. You can like no longer have children. Your body in some cases can be permanently changed from like taking hormones. Like the oldest trans individual, Buck Angel, he has been on like hormones for I think the longest period like or any trans people, and a lot of trans people try to silence him as well because he is very vocal about the dangers of like being on hormones for such a long time. Thank you for noticing the bottle of Tylenol, MHA lover. I do like in My Hero Academia as well. Too bad it's kind of there's not people are kind of bad at understanding the characters of My Hero Academia. Anyway, moving on or trying to continue. Buck Angel, the oldest trans person or the person who's been on hormones the longest, anyways, is very vocal about the dangers of like being on hormones for like a very long period of time. Like a lot of the time, doctors don't tell you the like potentially dangerous effects of being on like those kinds of medications for a long time. Like all medication has a drawback, and for some reason, doctors avoid talking about the dangers of being on hormones for too long. So Buck Angel almost died because his womb necrotized inside of his body, and then he had to get surgery for it. See, that is something that is not is very important to know. It's like I think knowing allows people to find fixes for it, find ways to prevent that kind of thing, and hiding it causes even more danger. Like saying that there's no like negative side effects to for being on hormones is very incorrect. It can stunt your development. It and that's like a very case of Buck Angel. It can almost kill you if you're not like keeping an eye on it. Like his womb necrotized inside his body, and he almost died because of it. And for some, both doctors don't want to talk about it, and then a lot of like trans activists don't want to talk about the dangers of being on hormones for like even just being on hormones in general. They like I think okay, this kind of like conspiracy, like tinfoil hat. I think doctors have a lot of money to gain off of like just constantly giving hormones to kids or adults is like fine. Like I don't care what adults do, but giving like hormones to kids, like I guess like money to be made from that.
You know, it's just a tragedy. Just call it what it is. I don't want to use the word indoctrinated, but I was young and I was sad and I was impressionable, and I thought that this would fix everything.
Yeah, it's basically what I said. People may just have like depression or just being uncomfortable with their body, maybe from puberty, or just having general anxiety. And if someone tells you, like, well, I guess what you have is you're just uncomfortable with your gender. It's like not saying it's like okay to be uncomfortable with your body, and it's not okay to be uncomfortable with your gender. Try to be that in like in a respectful way, because yeah, just be more clear. I'm trying to be clear about this. Gender dysphoria is a mental illness, and having a mental illness does not make you any lesser than other people. Like I have depression, and I don't think I am less well. So that's different. I do think I'm lesser than other people. But someone with anxiety or depression is not is not lesser than a normal individual, just like how someone with dysphoria is not lesser than a regular individual for having dysphoria. Like when I was a kid, I was like very depressed and I felt like any change in my life would be better for me. And I did have like struggles with like thinking about maybe if I was a girl, maybe my life would be easier, maybe I would be treated better. But those thoughts have gone away. I am a man. So if I followed the same like life as this individual has, I think I would have killed myself. I don't think there's a question about it. I'm pretty sure I would have killed myself because I already have like a couple like I have rough moments in my life. But but I think if I went the same lifestyle and then I would have regretted it and I would have ended my life because these are if permanent changes to my body, I can no longer have children. My body is no longer going to develop into like what I want it to be. So yeah, but I feel like my only option would be to kill myself. I'm sorry. Um, but yeah, I also struggle with certain things. But in another way, another thing is how like the people who even though people were trying to get rid of gender roles for a very long time, I think the people who benefit the most from gender roles now are like trans activists because now if a kid shows any deviation from their perceived idea of what gender roles are or what gender behavior is, they oh this kid is trans so we must transition them now and indoctrinate them into our ideology so we can gain more benefits for ourselves and take advantage of this individual. And then once we're done with them, then it is this whatever I don't care what happens to them after that, as long as I can get my benefits, like being able to go into the woman's bathroom without any repercussion, even though I'm not trans, I'm just a pervert, or like taking advantage of like women like and like female athletes and like being able to outperform them, and I take advantage of them. Okay. Oh.
I don't know what to do with like any of it. I think I just feel a lot different also though from most detrans girls because or detrans women, detrans girls and women because I've had bottom surgery. Like every girl I know has it. You know, they still have this part of them. And I don't have that. Like I don't have anything anymore. It's just so sad. Like, it just sucks so bad. This is just something I'll have to live with. You know, there's like no fixing it. There's no making it better. I have to live like this for the rest of my life and figure out a way to be okay with it. I'm not making this video for like sympathy or anything. It's just I'm wanting to express what's honestly going on in my reality right now as a detrans woman, as a woman who thought she was trans and transitioned, lived as trans for 8 years, had top surgery, a full hysterectomy, bottom surgery, went all the way as far as one could go, and then woke up and realized that I made the biggest fucking mistake of my life. I was so sure. You know, that's just crazy.
So she is not an anomaly. This seems to be like there's like a lot of other cases. I mean, it may seem like she's an anomaly, but there's many other cases of a lot of it is I think from what I've seen a lot of the time it's like a detransitioned woman and those people the reason why it doesn't seem very common is because these are the people that trans activists want to silence the most. They don't want people to realize that their ideology is dangerous. Their ideology is causing a lot of harm to people. So they benefit a lot from keeping these people's voices silenced. Even they even keep trans people's voices silenced by being a loud majority. And they another aspect they also keep trans voices quiet with like Buck Angel, um who yeah I already said someone who talk is very open about the negative effects of taking hormones for a long period of time. And then because trans people in general or dysphoric people already make such a small percent of the population, they can't really fight back. So that's kind of what my main struggle is. The perception of trans people has kind of deteriorated, and it's kind of sad to me. As someone who is, I guess, like to think of myself as more logical and more caring about individuals, there are a lot of people who, not a lot of people, I guess, it's just a small amount of people because it's like a small, I guess, a lot of trans people just can't fight back. Their perception is being ruined by people who are not actually dysphoric, just people trying to take advantage of a system. And let's move on to this. I saw this the other day. This boy began a trans identity at 12. His mother enabled hormones and legal name gender change. He was socially affirmed, even by the mayor. He was being prepared for surgery, but it was still not enough. On April 14th, at 17 years old, he attempted suicide with a bullet left him with a traumatic brain injury and both eyes removed. His mother is livid at her own son's survival. She plans to sue the doctors who saved him because they did not respect a DNR, which she claimed to have signed for him years earlier. So this is already a red flag. Why did she have a DNR signed for signed for her child? Like it says years earlier. Seems very suspicious. CPS intervened and took protective custody but his mother plans to remove him from the hospital and return when he turns 18 this week. She says they will live in hotels and flee to California, a trans kids sanctuary state. That's basically what Minnesota is. Well, it's kind of gross. I like live here because like trans sanctuary, different thing. Trans kid, that's kind of gross. But I don't think trans people need a sanctuary state. They already make such a small percent of the population, and most of them, like when I work at a store, there's like a couple trans people that come in. There's one customer I've seen once, and I think one I've seen a couple times, but I haven't seen them in a while. Hopefully they're fine. And they come in, there's normal people. I take their order as I take every other customer, and that's it. And then I just move on with my day. But it's like I treat people. It's like the adage: treat people how you want to be treated. Um, she also claims that his gender struggle had nothing to do with his attempt, Okay, red flags. Why was a physically healthy minor supposedly issued a DNR? Why did his mother draft this DNR years ago? Why was a distressed child allowed access to a gun? Why, if all the affirming life-saving gender preventive measures were followed, did this suicidality persist? So yeah, that's exactly what I said before. Um, how like if even if everything is affirmed, why does it seem like a lot of trans people have a much higher rate of suicide compared to like everyone else? As I stated before, it doesn't add up. This is the most horrifying case I've come across. Nothing about this mother story adds up. And I'm gonna ignore that. I think there are some comments. Transhausen by proxy mother. So that's kind of become a new term. I don't know what Munchausen is. Hold on, quickly look what Munchausen is. But it's like basically a play on words that Munchausen syndrome. Oh yeah, never mind. I know what it is. Mental health condition characterized by intentional fabrication or exaggeration of physical or psychological symptoms in order to gain attention or sympathy or for treatment. Okay, so yeah, that does seem to be the case. So here's other things. So she was using the transitioning of her daughter to basically farm TikTok updates. So okay, are you fighting for her survival or is she fighting to survive? I mean, this is a nice way. Does she even want to be here anymore, or is it? Okay, I don't know why you typed it so bad. So neither she's stable and she's ready for a patient neuro rehab facility. The doctors made her survive, and while in their case they made sure she stayed alive against her wishes, she still does not want to be alive. So I think I watched Leaflet cover this, and it seems like the consensus is that the mother possibly tried son killed tried to kill her son and like put a DNR on him years ago. Very suspicious. 17. Put a DNR on their child preemptively. I could not imagine doing that if like to my kid. Putting like basically planning for a suicide attempt or something. So like and put a DNR on them. Like basically expecting it and not doing anything to stop it from happening. That is very gross. Yeah, it looks like there isn't. I don't want to look at updates right now on this, so we'll move on to what our final thing before I just move on to gaming. Uh, Nyara is a twisted fetishistic freak that takes pleasure in poisoning the well for people who actually have some form of dysphoria. The infighting in the trans community pisses me off. There is a constant drama because people feel so comfortable and confident in dogpiling on trans women. You're not being seen as one of the good ones just because you try to take another down. This is narcissistic. This is basically calling someone else like calling trans people pygmies. Basically equivalent of when a woman defends a man in any way. It's like call pick me. Basically, this is the same thing. Pick me basically to call people pick me to basically try to make their argument like useless, I guess. Okay. Trans community. I don't like the. I think I talked about this a long time ago. I don't like the idea of putting community on a lot of different things like trans community, black community, LGBT community, white community, Asian community. I think that takes away a lot from the individual. And as I stated before, I care more about what an individual does. And I don't, because this basically implies that everyone within this like perceived community has the same ideology, and anyone who steps out gets ostracized instantly. You see right here. Yeah, like Barry, what Nyara was saying. But yeah, final statement: the individual is more important. Um, and we, sorry, the what an individual does, what an individual thinks, what an individual says is more important. It should only be applied to them. It should not be applied to everyone else. Like as like Martin Luther King said, judge people by the content of their character and not the color of their skin. Like you can apply that to everything, not just race. You can apply that to gender, maybe, and like gender ideology, like identity, not ideology. Sorry, gender identity. Well, that kind of thing.